I'm just wondering about the Care.Data issues that are going on at the moment. Obviously, yesterday we had the announcement that the rollout of Care.Data in the NHS is going to be delayed so patients have more time to make up their minds and have further information. Now, the whole programme's been fairly badly handled up to now, from what we've seen. I think it's quite clear that a lot of patients haven't had information. There's been a bad rollout of the way this has had. And, of course, in the press there's been various different stories. We've had stories such as 41% of GPs stating they will opt out themselves from actually sharing data, and that was by Pulse, who's, of course, the GP.
Are you a GP, Sanjay?
I'm not, actually. I've worked in healthcare for over 10 years.
All right. Do you work in this area on use of
over
data?
10 years at the senior levels. Right. I've been involved in information sharing projects which have been going on. As we know, the NHS has tried to share information for a long, long time, and there are different ways to do it.
I'm sorry, it's Nick Ferrari here. Moving to your question of Deputy Prime Minister, if I could, Sanjay.
Very, very quickly then. As we've seen with Care.Data, people haven't really got the information. What's your view on it? Are you actually thinking of opting out? Will you be opting out yourself?
No, I won't. And I'm obviously, as a leader of a Liberal Party, I'm always very vigilant about any storing or pooling of personal data when it comes to privacy and data protection and so on. But having looked at this quite closely, I think this is a sensible measure, because all the evidence is that by having that anonymised data, and it's really important for people to understand this, their data is not, their name and their address is not stored somewhere, but their anonymous identity is stored, plus their medical details. It is a very, very powerful tool to help in research. It's a very, very powerful tool in helping the NHS keep us well and provide better care. And as I suspect, Sanjay, you know better than I do, we've been pooling this data in the hospital sector for really quite a long period of time. This is just about doing that in the GP sector. But, and here's the big but, I completely agree with you, the public don't know about it. They haven't been well informed. It's right for NHS England to have taken the decision themselves, as they have done, to therefore delay the introduction of this and to work far harder to inform people, to also explain to people that they've got the option to opt out if they want, but also to explain the benefits of this in terms of better medical research and therefore better medical care. So I think it's right they're going to take more time. It's right they're going to spend more time explaining this to the public. They've got to work with the Information Commissioner to make sure that all the T's are crossed and the I's are dotted in terms of data protection and privacy, which I think they have taken care to get right. But they need to take more time to get it right.
Okay, thanks for that. I mean, I just wonder if you think they're actually handling it correctly, because obviously they were originally forced into informing patients.
I think we've had some pretty strong views. Just last year, thank you very much for your call, Sanjay. I'm only moving on because there's others we have to get involved. Just a supplementary question on this, which comes in from an email from Raquel in Dartford. In Scotland, you have to opt in. Why shouldn't it be the same for NHS England?
I think that's one of the reasons why NHS England should take more time to explain to people and explain to Raquel and all of us that if you want to opt out, you can.
But why shouldn't it be an opt-in, as apparently they do in Scotland? That seems to make more sense. I mean, you're persuaded of the merits. I'm not, for whatever reason.
Okay, well then you can opt out.
I can.
And indeed Raquel can opt out.
Wouldn't it be better that you had to opt in as they are? Why in Scotland they do it that way, do you suppose?
Well, one of the great virtues of the United Kingdom, dare I say it, is that we can do different things even though we're part of the same family of nations.
Are we all in this together?
Well, we certainly win the United Kingdom together, and I hope we remain together. But
as does David Bowie.
As does David Bowie. Yeah, exactly. One of my great childhood heroes. There you go. It's not. We don't, just because they do it like that north of the border doesn't mean we have to do it in exactly the same way south of the border. I think the judgment from NHS England is to get the best benefits for patients, so that we have better NHS care, better research, better treatment for medical conditions.
Deputy Prime Minister.
Yes.
I would feel very nervous now, and this is my first question to you, by the way, if you've noticed from me, and we're 18 minutes in. I'd feel
You keep saying this every week now, as if it's some sort of great...
I'd feel very nervous now discussing with my doctor a rather nasty rash that might have appeared if I think it suddenly get out there, if it's no longer be anonymous.
But if you go to hospital, you've got a whole lot of data which goes onto a database. I suspect when you go to your local supermarket, you've got things which you...
Yeah, but I don't go to them about a rash, do I?
No, well, OK, well, I'm not going to ask you about your rash on national television, on national radio. I think that would be inappropriate, really. And I'm a little squeamish on issues like that. But
you are sold on the merits.
Look, I think as long as it's clearly anonymised, as they put it in the jargon, so it's not Nick Ferrari of Three Orchard Close or wherever you live. Yeah. It is a record of medical conditions which can then be provided to researchers so they can provide better care for your rash. I suspect for the sake of your rash, if not anything else, it might be a good thing to keep your data on that database.
If anybody's listening, it was only an example.